Nurses of Reddit, what is your most "I can't believe I have to explain this" moment? Story 1. Was giving a grown patient IV Benadryl for a rash and itching on the upper body. The IV was in the right arm, so I started to give the medication into the right arm. The patient panicked when I said I was done. "What do you mean you're done? You only put it in my right arm. My left is itching too." Story 2. Oh man. Not a nurse, but I work in pharmacy. Had a guy come who wanted malaria tablets, but wasn't sure what area of the country he would be traveling in. Rural, he would need them, but the cities, he wouldn't. He said, "What's the worst that could happen? You could get malaria." Yeah, but how bad can that be? Dead. The worst it can be is passing. He left the shop anyway. Answer. Oh man, I had a lady set up an online appointment for vaccines, and she signed up for literal every vaccine available online. Yellow fever, polio, Hep A/B, Japanese encephalitis, rabies, everything. I saw those standard travel vaccines, yellow fever, rabies, and when the lady came in, I asked where she was traveling. I wanted to make sure she would get all her vaccines in time and that her doctor was sending in prescriptions for malaria polio prophylaxis if needed. She responded with, "I'm not traveling anywhere. I just wanted to get updated on everything before I lose my Medicaid," and then refused to get her flu shot because that makes you sick. Story 3. Pain-killing suppositories come in individual foil packets. After my C-section, the nurse handed me one and said, "Don't forget to take the foil off." I looked at her and went, "No. Somebody did that?" She gave me this really tired look and nodded. Ouch. Answer. I was hospitalized earlier this year for sepsis and needed a emergency colonoscopy to make sure I didn't have it to get a resection. I didn't. Yay. The nurse had to administer 2 enemas. Mind you, I am in horrible pain all over and my body is exhausted. I literally almost died and had multiple bags of antibiotics hooked up to my IV. I lay on my side and I feel a horrible pain. She's littlest jamming the top in and saying, "It won't go in." I've had enemas for scopes before. The tips are narrow and lubricated. This felt like sandpaper. She runs off to find another nurse. The 2 women are struggling to get the tip in, and I'm writhing in pain, wondering what the fudge they are going. Finally, one says, "Just squeeze hard," and I start feeling liquid pool around me. Immediately, I tell them nothing is going in. I know what it should feel like. Nope, they don't listen. Tell me to be patient. What? What for? 4 enemas, and me constantly telling them they are doing something wrong as I lay in a soaked bed before one of these 2 women realize they didn't take off the fudge neon blue cap off that is labeled "Remove." They got so quiet. And then properly applied the 5th without saying much. I asked them if they realized it had a cap, and they didn't reply. I later had a chat with the charge nurse and the hospital director. Even though they tried to brush this off as a silly mistake, I didn't once agree with them. My hospital bill mysteriously got waived. Yep, big fudge ouch. Story 4. I used to work on a cardiology unit, and we often would get patients that had surgery either later in the day or be next day. I was a nurse assistant and would constantly be arguing with patients because they think we are evil for not letting them eat. I haven't eaten in 15 hours. I'm like, "I'm sorry, dude, but either you don't eat or this process will begin again because these doctors don't want to possibly eliminate you." Answer. Oh God, I once broke my elbow at about 9 p.m. on the way home from college. Woke up about 30 minutes later in hospital. They explained what had happened and that I would have surgery in the morning. Yeah, about that. Busy day in ER, it kept being put off. By about 1 or 2 p.m., asked a nurse for water, and of course, was told nothing by mouth. After explaining the length of time involved, let me have enough to wet my tongue. The hunger was bad, but no fluids is brutal. Story 5. Did labor and delivery for a while. We typically inserted catheters after the epidural. A lot of women would ask how they could push the baby out if something was in that hole. Had to explain to many adult women the urethra and female body part are, in fact, not the same hole. Also had a couple where the husband fudged the wife's stoma and it got a gnarly infection. Explaining that you should not ever put your male body part directly into someone's stoma was a hoo-wee of a conversation. Answer. Bouncing off of this, my first day as a student nurse, nurse now. This woman is laying naked in the bed and says she's in too much pain to clean herself. Whatever. I inspect her stoma and start the bed bath. I get down to her crotch, and her husband decides it's a perfect time to start playing with her nipples, while I scrub her female body part. I don't know what the intent was, but I just got up and left the room. I didn't go back in. Story 6. I'm a neuro nurse. I once had a patient who was going into surgery the next morning, meaning they couldn't have anything to eat or drink after midnight. Well, at 4 a.m., I go in there to check on him, and he's drinking a cup of milk and eating cookies that his family had brought him. I asked him why he was eating, because he had surgery in a few short hours, and his reply was that he has a bowel movement every morning, so he figured we would be okay to eat because it would be out of his system before surgery. That's not how this works, Grandpa. Ugh. Surgery canceled. Answer: I feel your pain. Had a patient once, I'm an ER/RN, who came to ER for constipation because he didn't have his usual bowel movement after dinner. You see, he eats dinner at 6 p.m. every day, then poops at 6:30 every day. He thought this was his dinner that night, already making its way through his system. And when it didn't this one time, then obviously he's constipated. Story 7. Not a nurse, but I work in healthcare. I had to listen to a dialysis patient explain to me very seriously that he had gained 6 kilos of water weight in 2 days because he had sat in the tub for too long and had magically absorbed over 13 pounds of fluid. That was not a fun conversation. Story 8. Worked in the ICU at the time. Information written on the whiteboard. PT had pneumonia. Family freaking out, pulling hair, pissed. Mad that the hospital gave their family the dreaded strain of P. pneumonia. Took hours explaining to them that is how pneumonia is spelled. Dictionary, internet, co-workers. They still insisted. Facepalm. Story 9. 24U female PT with frequent UTIs. I explained that peeing after intimacy can help prevent them. She says she always pees after intimacy. She doesn't want to get pregnant. Had to give her a brief rundown on intimacy ed and her own body. Her parents made her get BC shots. One day I asked, "So you're okay with me getting pregnant because you don't pull out or wear condoms?" Him, "You pee after intimacy every time. That washes it out, right? So you can't get pregnant." He's 40. At the time, I was okay with getting pregnant. I reevaluated things at that point. Story 10. Had a patient with COPD exacerbation. Pretty much couldn't breathe and was drowning in the air she couldn't breathe out. Had to explain to the family that she should think about quitting smoking. Afterwards, the family was telling her to smoke through her nose and to just take shallow puffs. Answer: how do you even talk to a lifetime smoker about COPD? They knew this was coming. They smoked for decades and refused to stop. Now, their lungs are going to function worse every day until they die. It's like somebody jumping out of a plane without a parachute and then asking you on the way down how they can make it out alive. You can't, and you should have thought about that before you jumped. My dad quit when I was a kid. He's alive and healthy. Most of his peer group is dead or dying. Guess what they didn't quit doing? Story 11. I am not a nurse, but I work with patients in the surgical care unit at a hospital. The amount of times we have had to cancel surgeries or would have had to cancel surgeries because people don't listen to prep instructions is insane. No eating and drinking X hours before your surgery means no eating and drinking anything. Not Tums, not breast milk, not coffee, not anything. But we're the morons when it happens, of course. Answer: I went to the ER last year, and after they had tested some stuff and gave me a shot of something, I was feeling stable, but the scariest part was when I asked if I could have some water, and they said no because the doctor wanted to see the results of my CT first. That lasted for like 2 hours. I ended up being fine, but that was nerve-wracking. They were saying no to the water in case I had to go into surgery. Story 12. Not a nurse, but work in a hospital and have lots of nurse friends. One day, a girl in her early 20s arrives in the ER with the telltale signs of an STD. Can't remember which one. Nurse explains to the girl she probably has said STD and they want to run a test. Girl insists she can't have an STD, but they run it anyway. Sure enough, it's positive. The girl proceeds to tell the nurse that the test is wrong and to run it again. See, she only has intimacy with her boyfriend, and they were both virgins before they got together. Therefore, it's impossible that she got an STD from him. Story 13. My best friend is an ER doc. He lost count on how often he had to explain to people he can't prescribe antibiotics for a cold. People don't seem to grasp that antibiotics are ineffective against viruses, and that it's better to let illness clear on its own if possible anyway. I guess people still think antibiotics are the miracle cure to every single illness there is. Answer: that is a battle that will continue through time. Despite education, many people still expect medicine for things that don't require it. Discharged a patient with a suspected viral respiratory infection, and the physician prescribed the Z-Pak, an antibiotic. When I questioned the prescription, they simply said they wanted to go home with something. Facepalm. I guess the concept of giving it a week is less of a thing. Story 14. I had a woman once who was complaining that she couldn't breathe and started yelling at me when I tried to leave and go get her a tank of oxygen. I tried to explain to her that I physically had to go get the oxygen, which wasn't very far away, and bring it to her, but I guess she just wanted me to use my magic nurse powers and make it appear from thin air. Her O2 sat was like 97, by the way. Story 15. No, smoking crack is not going to fix your tooth pain, and it's the reason you can't breathe right now. I work in a large city hospital with a very impoverished and underserved population. This conversation was day 3 on the job, and the woman was genuinely shocked to learn smoking crack was bad for her asthma. Story 16. They interrupt me with, "Wait, so he won't be able to have puppies? I thought the females had the puppies." Needless to say, it was a very long appointment. Story 17. I had a patient who was in DKA, diabetic ketoacidosis. Not going to go into detail, but your blood sugar is extremely high, along with other abnormal labs. One of the goals is to drop the blood glucose, and the patient is placed on an insulin drip. I then had to explain nicely why eating candy at this time was bad. Story 18. After a lengthy conversation educating these two on the importance of feeding baby milk, they tell me not to worry. They understand. They will feed the baby 3 times a day, breakfast, lunch, dinner, with the cow's milk in the fridge. Answer. I remember being in the WIC office to sign up for benefits when I was taken out of work due to pregnancy complications. The new mother in front of me was 17, and when asked if her newborn was fully breastfed, she answered, "Yes, except for the cake and ice cream." The receptionist calmly explained that newborns shouldn't have anything except breast milk or formula, and this lady replied indignantly, "It was her birthday. She had to have cake and ice cream." I still can't believe that she wasn't just a special kind of stupid. Story 19. I had to correct the instructional handout given to me by a nurse at the gastrointestinal clinic. It said, regarding the pre-procedure prep for colonoscopy, if after drinking the gallon of Miralax solution your bowels have not emptied, go to the store and buy some magnesium sulfate. It should have read, send someone else to the store for magnesium sulfate. Story 20. The ridiculously high number of times I have to tell trashy jerk patients not to smoke in their rooms. Oxygen is flammable, and the walls are lined with it. You will literally blow the roof off of this place. Edit. I should have been more careful with my words. Oxygen is not flammable, but helps things burn hotter, faster, and at a lower temp. Thanks, guys. Answer. The hospital emergency department I work at has a recurring patient that everyone dreads. Not because he shows up for dumb stuff all the time, or that he never listens to anyone, nor is it because he's a rude jackass who stinks to high heaven. It's because he's a chain smoker with really, really bad COPD who refuses to quit, will fiddle with the oxygen if left unsupervised, and will smoke in his room with the oxygen turned upwards of 10 liters. Needless to say, after he nearly blew up cardiology, he got a security guard following him everywhere, and his belongings confiscated. Story 21. We had a male in for surgery, punched a wall or some such nonsense, and he decided to bring his entire family, to include wife, 3 infants, 2 toddlers, and 3 teens. Oh, and mother-in-law to boot. Patient's been waiting hours for surgery because he decided to steal one of the free sandwiches from our staff-only kitchen, and he's irate. Who knew aspiration could be so dangerous, huh? We suggest the family goes home, and, well, call them when he's ready. You'd think I just offered to sacrifice his firstborn child to the NHS. He starts screaming at me and the other nurses. He wants surgery now, etc. We just leave him to it and close the door. Father didn't like that and rambles on about how kids are kids and I need to stop being a meanie. He gets up in my face, and I call security, which calms them down. I tell him the ward is full of infectious people with CPECDMRSA, and if he wants to keep them here, they all need to stay in the waiting room, and they close the door. I'm back at the nurse's station doing my documentation when I catch wife then waddling from the clearly marked patient-only male bathroom. I walk up there and ask if she's just used the bathroom. She said she has. I ask her, did she not see the huge yellow sign saying male patients only, radioactive hazard? From her waddle, I ask if she's pregnant, with the smarmiest look on her face, and thinking I want to blab about the fetus I have no interest in, I pull down the door sign and ask her to read it. Her face absolutely drops. I tell her she needs to leave the ward with her children now. A hospital isn't a playground. The delay was because of her husband's foolishness. Time has been partied too hard from all ends because of their behavior, and she needs to visit her PCP to check whether her using the clearly marked patient bathroom will affect the fetus. The husband is fuming. Security is again called, and they all leave sans surgery. I literally document everything, and as far as I'm aware, he refused to come back for surgery at our hospital. Oh well. Pro tips. Don't eat or drink before surgery if requested. Keep your disgusting kids away from my frail patients. Keep your shoes off patient chairs. Don't use patient bathrooms if you're not a patient. You have no idea what happens in there. If you're pregnant, think of your unborn child before exposing yourself to the horrors of hospital infections. Story 22. Spent an hour trying to explain tactfully to my patient's family members why it was unethical to wait to withdraw care just so they could collect a check the next week. There was no concern for the patient's suffering, just about getting the next check. I wasn't sure what was worse. That the family was willing to let their dad guardpaw suffer an extra week for a few $100s, or that they felt desperate enough for money that prolonging his suffering was okay. Story 23. Not a nurse, but in a waiting room saw a nurse explaining to an old man that after she has put in the eye drops for dilation, he needs to sit with his eyes closed for them to work. Apparently, the first time he got the drops, he simply wandered off because he was bored. So after witnessing the nurse give him these instructions, guess what he did after 5 minutes? He wanders off again. The nurse had a, "I can't believe I have to explain this" expression the third time she was putting in the drops. Story 24. Obligatory not a nurse, but a medical social worker. My MIL passed away because my FIL has zero common sense. MIL was in bed and at some point suffered a stroke, tried to get out of bed, and fell into a sitting-up position on the floor, like a teddy bear would sit. FIL found her there an hour or 3 later when he woke up. He tried to wake her and could not, tried to get her back into bed and could not. He did not find this concerning. MIL had a home health nurse that came in and checked on her. She had Alzheimer's, but was still in the relatively early stages. The home health aide also tried to rouse her and could not. For some reason, the two of them decided that if she wasn't awake by noon, they would call the doctor. The doctor told them to hang up and call 911. When they finally got Milia to the hospital, she was essentially brain dead from bleeding in the brain. The doctors and nurses suggested that she may have had better chance at recovery had she not been left sitting and unresponsive for many hours. Phil got up at 7 a.m. and she was sitting bedside by that time. Phil is not an uneducated moron. He has multiple PhD degrees and teaches physics and astronomy at a college. Story 25. I had to sap my 73-year-old father down like a child and explained to him that he could eliminate himself doing this, or even worse, eliminate someone else. I told him I knew he was depressed about not being able to take care of himself anymore, but if he were to run over a little kid, he would never be able to forgive himself, and the last part of his life would be agony. He started to tear up and finally stopped driving. Edit. Format. I'm a mobile main. Story 26. My mom is a school nurse at a kindergarten. She has insane stories. One of the most recent ones involved a little boy and rock salt. While he was out on the playground, he found rock salt on the blacktop. He thought it looked cool and wanted to keep it. When it was time to go back inside, he was afraid his teacher would see it and take it away from him, so he decided to hide it. Unfortunately, his larger gloves and probably less developed fine motor skills kept him from being able to fit the handful of rock salt into his pockets. So, being a creative problem solver, he shoved some of his precious rock salt into the only other place he could think of, deep down in his ear. It was so far in, my mom did not feel comfortable attempting the removal in her office. School nurses have lots of training, but limitations on supplies, rules set by the district, and overprotective parents can really keep school nurses' hands tied. So imagine how fun that phone call was. Explain to a concerned parent that they have to take their kid to the emergency room to remove rock salt he stuffed into his own ear for safekeeping. Answer. My mom used to tell a story about when she put a bean in her ear. Said she heard a children's song that went, "You can't hear your teachers if there's beans in your ears," meant to encourage them to listen to adults. Well, what she took away from that song was that if you put beans in your ears, you wouldn't have to hear your teachers anymore. So she put a bean in her ear, had to have it removed by a doctor. I'm sure she still didn't listen to her teachers, though. Story 27. I'm not qualified yet, but I'm a student nurse in my last year, and I must have 1,000 stories that fit this. But some of my favorites are: 1. No, the maggots we put on your leg wound will not grow into butterflies. And no, you can't keep them as pets. To a 45-year-old teacher who had lost his foot to unmanaged diabetes, although I do wish they turned into butterflies. That would be awesome. I think they're beetle larvae? 2. No, we won't let your girlfriend stay over in your bed because you're scared to be in hospital on your own. I can hear the bed creaking and your heart monitor is beeping. You're not fooling anyone. She's going home. 3. No, I can't get you toast and jam right this second because you are diabetic for one, and there is a cardiac arrest going on in the next bed, which is why I am running past you and the room is full of doctors shouting and the loud emergency alarm is going off. 4. Finally, you cannot have morphine just because to the man in the bed across from you got some, he is a cancer patient, and you have come in with a chest infection. I think he thought because the bottle was open, I might as well dish it out. Story 28. 1. Why family members shouldn't put chicken down mama's endotracheal tube, the tube part of intubated. It goes into your mouth, down your trachea, and that's how a machine breathes for you in the ICU. Side note, why is it always chicken? It's never a hamburger or some SpaghettiOs or ice cream. It's always fried fudge chicken, these people. Yes, it happened more than once. Wanted to put down ET tubes. 2. Had to explain to a teenaged patient with a newly clipped blown aneurysm, abnormal bleeding artery in the brain, that doing cocaine and Adderall in combination was not a good idea. Even when studying, even if only when studying, do not snort cocaine and swallow Adderall together. This patient had presented to the ED with the worst headache of his life and a systolic blood pressure, top number, of 230. 3. Intravenous infusions of hydrogen peroxide by an unlicensed practitioner will not keep you young, save you from cancer, or extend your life. That one was a well-off, well-educated patient who had gotten heavily into woo. The aforementioned H2O2 infusions were why she was with us. She had developed a mycotic aneurysm. That's where bacteria infect the wall of an artery in your brain, causing it to weaken and bleed. They're easy to get if you're, say, injecting foreign substances into your bloodstream without sterile technique. I could go on for days. Story 29. I had to explain to a young lady where her female body part was. She wasn't sure. even though she was being evaluated for an STD check and had her 6-month-old son with her. When I gave her the antibiotics for the treatment, she also informed me she didn't know how to take a pill. She was 27. Story 30. Obligatory, not a nurse, but my wife is a medical assistant at a pediatrics office. She had a parent of a boy who was probably 6 or 7 say, in the most calm and nonchalant tone, "My son really likes to eat his own poop. Is this normal? Is this healthy?" My wife's jaw dropped and had to tell this mom just how unhealthy it is and how abnormal eating your own poop is. Story 31. Used to work in an ER in Chicago. We treated a kid with the flu that had a fever, gave him some Tylenol, fever came down, sent him home. 3 hours later, the family returned, complaining that the fever came back. His nurse had to go explain that you had to give the Tylenol again, and one dose doesn't just magically fix the flu. Edit. We also once had a father bring in his daughter because she got her period for the first time. We had an OBGYN come down and help the poor girl through it. Imagine how traumatic that was for a 10-year-old. Yes, honey, you got your period. It's an emergency. We need to go to the ER now. Story 32. Paramedic here. Got a couple great ones. Woman had a fluid retention issue, which caused her legs and feet to swell up with all the extra fluid. Her response to this was, I kid you not, to alternate soaking her feet in boiling water, then in rubbing adult beverage, because it made the skin feel tighter. As you can probably imagine, the skin had basically rotted off of her feet. This guy called because of a hard, painful lump on his rectum. I take a look. Sure enough, it's just a hemorrhoid. Start giving him some basic advice. Get some cream, don't strain when you poop, take a stool softener, etc. As an afterthought, I throw in, and no anal intimacy. And he goes, what? Really? Well, yes. Putting anything up there will aggravate it. He sighs dramatically and says, well, I guess no intimacy for me then, and stomps away. I can probably come up with a few more, but those are the most obvious. Story 33. I'm a nursing student who works in a pharmacy. As you can see from this thread, people need a lot of explaining for things that should be common sense. And this is why, in the pharmacy, we have to give extremely detailed instructions and counseling. Story 34. Not a nurse, but I was the idiot. After having my daughter via C-section, I was out of it completely, and then very disoriented. Nurse comes over to check on us, and I asked if I was allowed to pick my baby up. I have never seen a look of alarm like it. She just said, well, yes, she's your baby. Story 35. That is an STI, and I told him that he needed to speak with his doc before we could do any kind of shot, but he insisted. I went to immunizations tech to confirm our protocol, and he said the same thing. I picked up the phone again and repeated the protocol, but they refused to listen. I went to immunizations tech and asked if he would be willing to speak to the patient as he wasn't listening to me. Some patients like to think that you're just a dumb front desk clerk, and he said he would. After speaking with the patient for about the minute, the immunizations tech came to the front desk and explained that the patient actually needed the Japanese encephalitis shot. I couldn't stop laughing. Story 36. Not a nurse, but during shadowing, a patient couldn't understand why they didn't need a specific prescription anymore. Her levels were normal, yet she thought she needed the medicine to stop it from happening again. Doc spent 30 minutes explaining to her the medicine was harmful to a patient like her if her test results were back to normal. After tons of debate, the doc sighed and looked at me. So I went and made a super simple drawing using red and green crayons from the kids' table in the lobby to explain good and bad. Doc laughed at the drawing because it was so dumbed down to an insulting level of someone reading it. But after showing it to the patient, they understood in like 2 minutes and left happily. Between patient's ID, chat with the front desk ladies, and overheard the patient saying, if the doctor started out with the diagram, her visit could have been much shorter. Answer. I feel like this means you're going to be good at your job. You found a different way to communicate with someone in a way that made me understand and leave happier and healthier, ideally. So as annoying as that lady was, I'm not going to focus on how she wasn't grasping the material, but how you've got great communication skills for meeting people where they are, which will serve you well no matter where you end up. Story 37. I had a DNRN patient who was clearly going into the second phase of septic shock. Despite explaining that the man is actively dying, the wife, who is a nursing instructor herself, made me call the doctor. The doctor proceeds to order 2-liter bolus of normal saline and blood cultures. We essentially drowned his veins with fluids, and his blood pressure didn't come back up, not to mention causing him unnecessary pain pricking him with needles. The patient died before the culture results came back. Story 38. Literally last week, we had a guy come into the ICU with a K of 8.8. Apparently, he had had low K when he went to his PCP the week before, so they gave him a supplement, and he started popping them like candy. Although it was clearly stated on the bottle not to exceed the recommended dose, he thought he might have a lawsuit on his hands for no one explaining it to him clearly. Cue facepalm. Story 39. Not a nurse, but have kind of a funny related story. It was one of those, you know what, you call someone who gets all C's in nursing school, a nurse, moments. Was in the ER with a family member who was basically dying of old age. They had to put a catheter in and asked us to step out. It took for darn ever, like way longer than I know it takes usually. When we came back in, they had forgotten to close the web browser on the computer. It was open to a Google search of female urethra. I could have died laughing when I saw it, had it not been a fairly grim situation. Answer. More than likely, there was someone in training placing that catheter that needed a little help with anatomy. The first time I taught someone to place a Foley on a patient instead of a mannequin, this 80-something-year-old dementia patient told my very shy and introverted orientee that the thing he kept hitting was her clit, and he could try going a little lower. The shades of red I saw for the next 5 minutes was amazing. Story 40. So I have a real issue with sticking with a career. So I'm both a nurse and was formerly a private chef. I'm well-rounded, I guess. At a family gathering, an aunt asked me about healthy diet options. I touted avocados as an excellent source of healthy fat. Cue shrill, mocking laughter from my now estranged SIL. SIL had maxed out at the high school diploma, but told everyone she had gone to culinary school because she took a few elective cooking classes. Healthy fat? There is no such thing as healthy fats. Fat is fat. God, you're funny. Total mocking condescension. I stared at her blankly and said, I'm surprised they didn't touch on diet at all in culinary school, and then resumed my other conversation. Yeah, and as a nurse, I'd think you'd know about diet. I stared blankly again. Yes, I do. Google it. Story 41. My best were all from telenursing, covering for an OB office. I had to explain to a grandmother that it was not normal for the cord to be hanging out of her very pregnant granddaughter. I had to explain to a girl that her unborn child doesn't eat when she eats, and that it's okay if she missed a meal. Another lady was concerned that her unborn child may catch the stomach bug that was going around. Story 42. I am not a nurse, but still wanted to comment. Sorry, a girl I used to work with made a comment about how her eyesight was funny that day, and it felt like she was seeing 3D. So I explained to her that it was normal to see everything in 3D. After explaining everything, she was quiet for a bit, and then started laughing very hard. She continued saying, "Oh my God, of course not. Why else would we have to wear 3D glasses when going to the cinema?" I just gave up. Story 43. One of my clients was being treated for a pretty serious abscess on her foot. A doctor wrote nursing orders for wound care, which is pretty standard. The RN shows up on the first day, and the client was utterly confused. The client thought the safest way to treat a wound was to bandage it, and to leave the bandages in place until the wound completely healed. She had never before changed dressings or cleaned a wound while it was healing, and she was very resistant to having her bandage changed. She kept saying, "It doesn't even smell yet." Answer. A 21-year-old acquaintance had an accident with a hatchet over Thanksgiving break. He was cutting wood, his foot slipped, and he hit himself in the ankle with an 8-inch hatchet. Only soft tissue, but a nasty 8-inch gash and 80 stitches, inside and out. I stopped by a few days later and asked him how he was doing. Okay, but man, my foot hurts. Take a look at it. Weeping, inflamed, red streaks. green pus, horribly, terribly infected. It took almost 30 minutes to convince him to go to the emergency room. Apparently, "You will lose your foot and possibly die if you don't go in the next 8 hours" wasn't good enough. He still only agreed to go after his class. Story 44. My girlfriend works in healthcare, though not a nurse, and the number of people that simply refuse to hear an unwelcome message is unreal. Example, she told me, person has lung cancer, is told this is most probably from smoking. Most probably? Asks the patient. Is then explained that, of course, there is hardly ever a single thing that can be pinpointed to the development of cancer, but that 86, might have the incorrect number, of the lung cancers is attributed to smoking, and that it is rare to see lung cancer in someone who has never smoked. Patient walks to family waiting outside, and my girlfriend hears the patient literally say, "Doctor said it's not from smoking." Story 45. I work in burns, and any burn trauma nurse can tell you a good portion of their patients are just admitted because of poor life decisions. Here are some conversations I've had. Don't put accelerants on a campfire, bonfire. Don't go back into a burning house, vehicle, airplane. Don't put accelerants on bonfires. This includes aerosol cans of stuff. Those blow up. Don't make meth unless you have an advanced degree in the field. Don't put accelerants on bonfires, even if it just won't light. Don't let your pot handles hang over the edge of the stove where your kid can reach. Don't put accelerants on bonfires, even if you've been doing it for years. Don't pick up containers of flaming grease and oil. Don't put accelerants on bonfires. Diesel is an accelerant. Don't keep electric cigarettes in your pocket. If you wear oxygen, don't smoke with it on in your lap. Edit. Don't burn trash. You don't know what the fudge is in there. Probably accelerants. Don't dispose of excess gunpowder by lighting it on fire. Don't put accelerants on your goddamn fire. Story 46. I had a labor patient that had just received her epidural. When I went to place a urinary catheter to keep her bladder drained, her husband said, "If you put that in, how's the baby going to come out?" I've learned over the years that lots of guys don't know their female anatomy. Story 47. Worked at a veterinary ER practice in college. Had a couple bring in their sick puppy. As we were gathering info about what happened, the wife started giving raspberries, blowing with her mouth on the dog's tummy, but on his belly button. I had to explain that his belly button was about 2 inches above where she was blowing and wasn't an outie. She'd been giving her male dog little BJs for months. Ooh. Story 48. My wife had a patient that said she was having problems with her pink lady. My wife didn't know what she was talking about, so she asked a fellow nurse, who replied, "She's talking about her snatch, Angie." Wife asks other nurse, "What's a snatch?" She was 35 at the time. Story 49. A woman that came in with a broken tib fib on the orthopedic surgery ward, who was on strict non-weight-bearing orders to her broken limb, was hell-bent on getting herself downstairs so she could have a cigarette. It took 2 of us nurses to kindly explain to her that she would permanently F up her leg if she did so. Another favorite is the patients who answer no when you ask them on admission if they have high blood pressure. Their pre-admission medication list shows they are on Norvasc, Cozar, etc. What are you on this medication for? Oh, that's my blood pressure pill. My blood pressure used to be high, but not anymore. Facepalm. Edit. Just remembered a patient with an infected leg ulcer that we found a raw chickpea inside. The family said it was holistic medicine. I'm all for people using alternative approaches if they believe it helps, unless it is causing actual harm. Story 50. I had to explain to a family staying with the patient in the room that while at home they can do whatever they are accustomed to, here at the hospital, they had to wear clothes. 80-year-old patient, 80-year-old naked wife, and late 50s naked son. And since there is only one guest bed, naked son and mom spooned all night. Story 51. Global anoxic brain injury. Overdose, long-term oxygen deprivation, brain passing. I had to explain to the family that we can't do brain transplants. No, that's not a thing. Even considering the absurdity of medical television, Where do people come up with this stuff? Story 52. Labor and delivery nurse. Couple on tour. Asked what we meant when we said we'd assess cervical dilation. Explained that we check your cervix with our fingers in your female body part. She literally screamed. Seriously? Fingers in my female body part? Do you not understand there are bones in your fingers? She kept insisting nothing in her female body part, but during one of their many triage visits insisted that I explain to Get Husband that intimacy 8 to 9 times a day was normal for her. I could not follow this lady's logic. Story 53. I was on my last year of nursing internship and had to stop a guy drinking our adult beverage hand rub from the dispenser. No, sir, that's not edible. And no, sir, that is not adult beverage like Guinness, vodka, or beer. Story 54. Had to spend 15 minutes on the phone with a patient to convince them to go to the hospital. They had called for an appointment because they were feeling short of breath and having chest pains when walking less than a block. I told them not to come into the office, to go to the hospital immediately, and that if they came into the office, we would be unable to treat them and would have to send them to the ED. The patient refused to go to the hospital, said that they just thought it was a head cold, that they needed to see the doctor today, a doctor who was overbooked by 6 patients already. Guess who showed up at the door to my office 20 minutes later and had an ambulance called for them? Story 55. I'm an ER nurse. Had a woman come in one night following an MVA. Fairly minor accident, but the side window next to her shattered, showering her with glass. She was pretty shaken, but thankfully not injured. When we told her she could go home, she became hysterical, sobbing uncontrollably, accusing us of not treating her injuries because she was convinced she had glass in her brain, and kept insisting we remove the glass from her brain. I kept trying to explain that there couldn't possibly be glass in her brain because there wasn't any broken skin, lacerations, or hole where the glass could get in. Finally, realizing that logic was not going to win here, I called the housekeeper, asked if I could borrow her shop vac. I put this smaller attachment on the end, then spent about 10 minutes vacuuming her head, after which she thanked me and calmly went home. Story 56. On the veterinary side of things, we have plenty of fun convos with clients. One woman was concerned about her dog remaining so overweight and wasn't sure what to do to get it to lose some. She later casually mentioned that her husband likes to buy the dog its own Happy Meal from McDonald's. Story 57. I'm not a nurse, but an MT and a technical services coordinator for the core laboratory. Sort of like a liaison between the providers and the lab. So while I've never said I can't believe I have to explain this to a patient, I have said I can't believe I have to explain this to a nurse hundreds of times. A few days, a nurse sent me a sample for an anti-Z heparin assessment in a lithium heparin tube. I called to tell her that it's going to be canceled because we can't monitor the patient's heparin level if the anticoagulant in the tube you collected is heparin. To which the nurse replied, "Ugh, can't you just run it anyway?" No. Story 58. I had a patient complain because I chose to assist my other patient first, even though she clicked her call button first. Even though the patient that I assisted, her roommate, called me because she was having 1010 pain and was 1 day post-op from having an ORIF. But me refiling her water in her mind took priority. Story 59. Not a nurse, but was in the ER when my ex was a patient. When the dude in the next bed learned something new. He was an old, loud, funny African-American dude. He was in for complications from diabetes. The nurse doc is asking him questions. Do you have trouble walking? I can only walk a block or two. Do you have vision problems? I can't see shoot. Do you ever vomit? Every day. Have you been taking your meds? Well, see, I found a way to deal with my problems without those medications. A little green stuff helps a lot. Okay, well, you haven't urinated in a long, long time, so we'll get a catheter in you and get you some help. All right. I was surprised he was so low-key about the catheter. Then the next time a nurse comes in, he goes, "So, what are you going to do with that catheter thing you said?" The nurse must have whispered it, because next thing I hear is, "Oh, hell no! Hell no!" Story 60. Does the reverse work here? I was in a healthy study, and an elderly nurse was going to draw blood. I've had my fair share of blood draws, and something seemed off. I won't pretend I know exactly how the process works, but usually they do something to keep the blood from coming out after they get the needle in, and before they can put the blood draw tubamajig in there. Well, she pulled whatever stopper was on there and turned away, and I got to watch my blood fountain out of me, and all I could muster was an, I think something's wrong, before she panicked and clamped down on my arm to stem the blood flow. Ruined a perfectly good pair of jeans. X200B. TLDR, sometimes the nurse makes a mistake and you become a blood fountain. Story 61. Most recently, had a patient with a progressive wound that wasn't healing, encompassing his man parts and rectum. After many skin punches and cultures, he came back positive for a bacteria only found in doggy mouths. Imagine my face when I had to explain to this patient that the dog's mouth was not a substitution for showering. Yes, you read that right. He was allowing his dog to lick his junk and wound with the assumption of an old wives' tale about how dogs' mouths are clean. Story 62. This is one of those how do you get by in life stories. I had a patient who had a pretty bad heart attack and got a stent in one of her coronary arteries. I was discharging her and went through lots of education with her. I showed her stent card. It's just a wallet-sized card that has all the details of her stent printed on it so that if she were to go to any ER in the country, she could show the staff that card and they'd know exactly what kind of stent she had. And showed her how it came on a piece of thick paper and that it was perforated along the edge and she should tear the card off the paper and keep it in her wallet. I went on to educate her about her new meds, her heart-friendly diet and exercise plan, and her scheduled follow-up appointments. Finally, at the end of everything, I asked her, "Do you have any questions for me? Anything at all?" She goes, "Yeah, what does perforated mean?" I just hung my head. Not only had she stopped listening, after the very first thing I said, she did not know what perforated meant. And more so, she thought the word was purpurated. I went on to explain what perforated meant, and she said, "Okay, thank you. I'm ready for my wheelchair." There is no way in hell this woman understood 110th of my discharge education. I really didn't think I would ever have to explain to someone how to tear something off along the perforated edge. Story 63. Needless to say, I had to explain to him not to pour bleach on your wounds. Story 64. Not a nurse. I'm a therapist. I had a patient who had lost her firstborn to Rett syndrome. She felt really guilty because she had gone to family constellation therapy to cope with the pain, and the constellator ended up convincing her that she had given her daughter Rett syndrome because she hadn't gotten over her traumas. I spent an hour explaining that Rett syndrome is genetic, and her sadness couldn't have caused it. Fudge, charlatans. I hope they all die and go to hell. Story 65. That I could not handle turning the 650-pound-plus patient by myself, and I needed help and equipment. I had to explain why a 135-pound me could not simply get someone more than 3 times my size up by myself. By federal law, I am required to use not only additional help and equipment, I even had to print out the hospital and federal guidelines to show this idiot why I was refusing to destroy my back and not risk my job. And no, it was not a pride thing on their end. They were just assholes. Same person had a chicken leg hid under their breast and was pissed off I took it and threw it out. Upon admission, gross, because they were no and could be going for test the following AM. If you work in the medical field, you know I'm not making it up. Story 66. A patient came in for appendicitis. Had a history of alcoholism and an EF of 20 to 25. After learning the anesthesiologist didn't feel comfortable putting the patient under for surgery, he requested that the surgeon put him under with adult beverage, like they did back in the Middle Ages, because they did it all the time back then. After a long silence, I had to explain why this hospital did not perform surgery that way. Story 67. I had to explain to a grown woman who the father of her baby was. She just found out she was pregnant and had intimacy with 2 different men recently. It turned out she had intimacy with one of them before her last period and one after. She didn't understand the relevance, though. I had to explain the whole story about ovulation eggs and sperm, and what a period actually was to her. I think she was actually older than me. Story 68. Wife isn't a nurse. She works closely with them at the hospital. Right before our kid was born, she told me she heard about a mother who wanted to feed her hours-old baby whole strawberries, kept asking for them from the cafeteria. They apparently could not explain it to her clearly enough that an hours-old newborn child does not, should not, and cannot have whole strawberries. Story 69. A conversation with my parents about our family's medical history when my dad's listing his conditions. Well, I'm fat, diabetes, high cholesterol. That's it, though. Me. Dad, I know you have high blood pressure. Him. No, I don't. I have pills. Me. Dad, just because you are on medication for it doesn't mean that you don't have hypertension. Medication treat it. The pills don't cure it. You're on medication for the diabetes and high cholesterol too, but you still have those. Him. No, I have pills. Pan over to my mother and I, staring at him like the eighth wonder of the world. How is he not getting this? The argument is still ongoing. Story 70. An old man thought that urine was stored in the stomach. I can't possibly try to pee right now because I didn't drink any water yet. My stomach is empty. I told him that pee doesn't work like that and that it actually comes from his kidneys. No, I have to drink water, and it's in my tummy until I have to pee it out. Story 71. Not a nurse, but I had to tell my, at the time, 30-year-old sister who was going through a pregnancy what prenatals were. Also, had to have an extensive and thorough safe intimacy talk with her. All while my 64-year-old mother sat in the living room doing crossword puzzles. I'm younger than my sister and asexual. It still astounds me that I had to be the one to explain any of that to her. Story 72. As a vet tech, trying to explain to someone who refused to speak to the male vet because saying hello is somehow intimacy harassment, that her puppy had parvo because she didn't vaccinate it because she didn't want an autistic dog. Then trying to explain that her supposedly 1,000 dog was going to die if not treated. There was a shot clinic that vaccinated against parvo for 18 every weekend. She had 4, not even school-aged kids. Story 73. I'm a nurse and called the respiratory therapist, who was from Australia. My patient keeps complimenting her on how smart she is and how well she speaks English, considering the people in Australia aren't as advanced. We had to explain to this woman that Australia is as modern as America. Story 74. The doctor examined the kid and asked the mom what she's been feeding him, and she said, oatmeal. That's all he wants, so that's what I give him. The doctor then had to explain to the mom that, no, you can't survive solely on oatmeal, and that her son had scurvy. Fudge scurvy. Story 75. Not me, but a relative working in a small community hospital in northern Canada. After this woman had her 13th child, the doctor and nurse had a meeting with this couple to talk about birth control. He was completely against getting a vasectomy, so tube ligation was explained to the couple. Afterwards, the husband says, "Oh, great, let's do that. I thought that you guys were going to sew her hole shut." Story 76. Please do not take your loved one out of his body bag and take pictures of him. Backstory is, the patient had coded with about 10 family members in the room. The sound of their screaming drowned out the code bell, which is very loud. All of the people responding, myself included, couldn't even get to the patient. After getting everyone out, including one family member having to drag another out who had fallen out, we coded the patient. They lived that code, but coded again about 20 minutes later and did not survive. The nurse who had the patient was in the bathroom, so I went into the room. I walk in and see the patient has been unzipped and is halfway out of the body bag. About 6 people are standing around him, all with their phones out, holding them up in the air taking pictures. So casual, like they are trying to get a good angle of their food for Instagram. Could not believe that I had to explain they could not take photos and had to leave as I zipped him back into his body bag. Story 77. Early 70s man was in for rehab following knee replacement. In a stroke of poor luck, he had an unrelated MI and passed away. The family came in immediately and were pretty broken up as to be expected. The man's wife was in the early stages of dementia and was saying things like, "Darn you, "How could you leave me, you bastard?" While standing beside the bed her husband's remains were in. The 40-something daughter asks me to step out of the room, and I shoot you not, in a dead serious question asked me. She is saying really mean things. Do you think he is still able to hear her? It took all my professionalism to not be like, really? But I thought a second and said, not in the way you can hear me, but maybe in the way Jesus can hear you. Big sob and, oh, thank you, thank you, thank you. Felt really bad for her. Story 78. Was a care nurse dealing with elderly service users. We had a new hire. She went through her training and was let loose on this old gent that needed a urinary catheter. This particular type was a sheath that was placed over the male body part like a condom. Unlike a condom, it's meant to be placed over a flaccid male body part. Evidently, no one had told this poor girl this. The old boy was most upset when we reallocated her. Story 79. Not a nurse, but an EMT. I once had a patient high on hallucinogens who was convinced she wasn't breathing. She was. "I'm not breathing." "Do you mean it's hard for you to breathe?" "No, I mean I am not breathing. I can't breathing." "You are breathing." "How can you know?" "No, I'm not." "I promise that you are. I'm watching you right now." Story 80. Not a nurse, but was a naval medic. I had a young trainee officer come into the med center upset that she had, and she whispered it in a very posh voice, creepy crawlies in her underwear. I had to explain about crabs and how you caught them. I started to discuss contact tracing, and she said, "Oh, I have only had intimacy with one person last weekend, but I couldn't have caught them from him. He is from a very old and established family." I had to explain that pubic lice are not issued with the family trees of the people that they infest. Story 81. My twin sister is a chiropractor. I'm a nurse. She has a baby in September. She got pregnant again at 3 weeks postpartum and came to me saying, "But we only had unprotected intimacy a few times." I had to tell her, a 33-year-old self-professed doctor, how biology works. She teaches a natural family planning class and has had 2 unintended pregnancies in less than a year. She makes over $100,000 a year. I make $24 an hour. Story 82. Patient. "I'm in so much pain." Nurse. "Have you taken anything to help with the pain?" Patient. "No." Nurse. "Why not?" Patient. Story 83. Not a nurse, but had to explain to my 20-yo friend what a placenta is, that the cord goes to the belly button and not to a biological oxygen mask on the fetus's face, and that the food doesn't go directly to the fetus. I love her dearly, but darn, I laughed so hard right in front of her. I think I'm going to show her this thread so she doesn't feel bad. Story 84. I had a paraplegic patient once who had an order for baclofen every 8 hours. That's 3 times a day. I tried to explain to the patient that if he seemed drowsy, then I was required to hold the baclofen. This made the patient very angry. On at least 2 occasions, I went into the patient's room and found him dozing off. I was just told the baclofen at those times, only to have the patient angrily press his call button about 30 minutes later, telling me that I should have woken him up so that I could have given him his baclofen. When I tried to explain to the patient why it would be improper to wake him up to give him a muscle relaxer, he scolded me and told me that I didn't understand what it was like to be paraplegic, and he tried to get me assigned to another patient. It turns out that his friends and family had brought him a large tube of baclofen that he was taking on his own in between the schedule doses at the hospital. Because it was in his possession, we could not take it from him. We just have to keep documenting that he was too drowsy every time we try to administer the scheduled dose of the baclofen. The physician ordered a baclofen level to determine if the amount in his system was more than what we were able to give him at the hospital. Since it obviously was, he was fired as a patient. TLDR, patient was taking excessive amounts of baclofen and becoming very drowsy as a result, and kept getting angry at me for not waking him up to give him more baclofen. Story 85. Not a nurse, but my mom has been for 22 years. Had a lady once bring in a huge list of medication allergies. The allergic reactions she listed were what the medication was used for. For example, aspirin thins my blood, Lipitor lowers my cholesterol, etc., etc. I said, "You realize those reactions are the intended use of those medicines, right?" She was baffled. Story 86. A little different take on this. I'm a former nurse with a type 1 diabetic daughter. We were in the ER a year or so ago because we thought she was developing DKA. The RN actually asked how high her sugar would go if she didn't take her insulin. The woman was baffled. My daughter's sugar had been fine because they were flooding her with IV fluids. Another T1D I knew had been thrown into congestive heart failure by the same hospital giving her excess fluids. At that point, she had been without insulin for 24 hours. I had to stand my ground and insist they get an order and get some insulin into her. Later that day, she had to eat so we could go home. After a carb-rich meal, the nurse went off to get some insulin and didn't return for over 30 minutes. Story 87. I'm not a nurse, but since this happened recently, and it has to do with health, here you go. I had to explain to a coworker that you have to change a baby's diapers even when they pee. You can't let a baby sit around in a day's worth of piss just because the baby hasn't pooped yet. She claimed to have worked with 0 to 6-year-olds for 13 years. I really feel bad for the children she's worked with in the past. Story 88. Probably too late to the party, but I'm not an RN, but I am an MRI tech. The one that always sticks out in my mind was the time I told a patient that he had 5 minutes left. He looked up at me and asked me, "How long is that?" I could only respond, 5 minutes, with a look of utter surprise, irritation on my face. Story 89. I'm a nursing student doing it for my pre-med. First of all, I dislike kids. Like, 1 or 2 is fine to babysit for a couple of hours, but more than that, for longer than that, plus sickness, plus parents, equals no. I was placing an IV for a child who was crying because, newsflash, IVs hurt. Not a big deal, right? Well, this kid's parents were threatening to sue me, get my license revoked, even though I explained multiple times that I'm a student, etc. I can't wait to graduate from med school and not have to deal with children on a regular basis. Story 90. Obligatory not a nurse but story. My friend is a nurse and was dealing with a man who came in suffering from urinary retention. He insisted on standing while he explained his symptoms because, apparently, his testicles were bruised. After questioning from the doctor, they were then shown what she describes as a massive purple ball. Apparently, he thought his balls produced pee and was trying to squeeze it out. I was always skeptical of this story, but after reading the rest of the comments here, answer. I had a coworker, in some weird conversation that I don't know how we got into, say something about squeezing his balls when he pees to make it come out faster. I said, "You realize that isn't where your pee actually comes from, right?" And he immediately starts laughing and gives me a look like, "Sure, buddy," and walks away. Same guy blamed my migraines on my ponytail being too tight, after I had explained 3 times that I had only had long hair for 5 years, and my migraines started 17 years ago. Story 91. Some nurses I worked with got seriously pissed every time they had to explain people with thorax cancer or whatever, lung cancer, that smoking was bad, and very likely the reason they got the cancer. And if they didn't plan on stop smoking, they would likely never have a chance to recover. So many of the old people simply didn't trust the nurses or doctors, ever. Story 92. Not a nurse, but a nurse aide. I work with dementia patients, so I guess I could believe I had to explain, but one time, I was helping feed a resident who earnestly asked me, "Okay, so now what should I do with it? Leave it in my mouth?" after chewing several bites of food. Story 93. Just had a woman yesterday tell me she does not brush or floss because her saliva is so strong it eats everything. Paraphrase. 4. Found cavities on the x-ray later. Had to walk her through the mechanics of brushing and flossing. 27 and I had to teach this to her. Goodness. Story 94. I wasn't the nurse that had to do the explaining, but it was funny watching them and the words they chose. I did a paid.